Thank you very much for joining us. It is a special edition of Diaspora Fusion, and we are discussing COVID-19 in East Africa. Now, Kenya is grappling with COVID-19 cases as the country aims to vaccinate some 10 million adults by June 2022. Uganda just suspended parliamentary sessions after 200 positive cases of coronavirus were reported in parliament. Just this week, Tanzania recorded 100 cases for the first time in 1 year. What are the lessons that we can learn in the region, and is there enough coordination that is happening to combat the pandemic? On set, we have Dr. Simon Kingondu, who is the Secretary General for the Kenya Medical Association. He is also the training manager for COVID-19 in the association. My far left, we have Eugene Anangwe, who is the General Manager, Lookup TV, and Lookup Media, the General Manager for Lookup Media. We are in this season where we are experiencing what we can refer to as the fourth wave, which seems to be lethal because every time you're on social media, there is a death related to COVID-19. Every other day, we are seeing a surge in COVID-19 in Kenya. What is not happening and what's happening?
Thank you very much for having the Kenya Medical Association on the program. First, we start by sending our condolences to those who may have suffered severe COVID-19 or even death as a result of the illness. The health workers have not been spared. And if you have been following the stories of health workers who have been affected with COVID and some of whom have passed away, then you'll know that the frontline health workers are actually the first line of defense, and therefore at the highest risk of not only contracting COVID-19 at the workplace, but also dying from the same. As a result of that, coming back to your question of why now every time you open your set, then you may find a sad story of someone who may passed away. It's all about the health system. It's all about the numbers of COVID-19 infections. When the first case came, then you are unlikely to hear of a death because it was one person, 2 people, 3 people. But the statistics of COVID are such that out of 100, 90% would be asymptomatic or mild in COVID. That means they will not die. 10 to 20% would suffer severe disease. And from those, maybe the initial statistics were that 5% may end up dying. Now, what happens when you have more numbers? If you have 100 with these statistics, then out of every 100 people, maybe 1 to 5 may die. If this number goes to 100, then you multiply that number by 10. If the number of infected goes to 10,000, then you multiply that number by 100. And therefore, the fact that you are having more people dying as a result of COVID is just that you have more infections in the community. And with that, then the COVID may actually now encounter patients who are susceptible. And we have seen the risk factors for death, although they may be changing slightly, are comorbid infections. Like they did a survey for Kenya and saw that majority of those who passed away may have had some form of comorbid diseases like diabetes mellitus, blood sugar problem, blood pressure, hypertension. All these infections tend to affect heart disease or lung disease, and therefore, the more the numbers there are of COVID infections in the community, the more likely they are to affect people who may be more susceptible to this. And therefore, the numbers you see are exactly as a result of that.
In Kenya, we've had a lot of ups and downs with the workforce, the medics, that is, the healthcare workforce.
Yes.
And I want you to appreciate the kind of fault lines within the front line. We are not seeing so much strikes, but are we doing enough with just about 1.2 million vaccinated, and you're focusing on about 10 million adults being vaccinated by 2022?
Thank you very much again for that question. And COVID-19 came to show what the underbelly of the health system in Kenya is. Prior to COVID-19, there were also issues in healthcare service delivery. And the main issue in healthcare service delivery for this country is as a result of the health workforce to patient ratio is low. And the investment towards the human resources for health is also low. The association has on many occasions written to the Ministry of Health and to the government in general to improve especially the public health human resources for health via what we are calling a health service commission. Going back to the debate of devolution of health, we as the association gave advice that the way the devolution of health was done was not correct, and therefore this affected the distribution and the continuous engagement of human resources for health. For instance, the automatic employment of, for instance, health workers into the public service stopped in 2016. And as a result of that, this has meant that the number of healthcare workers vis-a-vis the workload has been very low. As a result of that, we have had a lot of medics having burnout. And when you have a lot of workload and you're not supported, then the risk of actually getting infected, even with COVID, is a lot. As the association, we also took part in the formulation of the human resources for health COVID protocols. These were disseminated to the counties, and some of the recommendations, for instance, were that because of COVID, health workers should work in shifts. This was not implemented because the county government said that they do not have enough workforce and they do not have enough workers to go around. Therefore, a recommendation that has been done to protect the health worker is not implemented because the county government claims that it does not have adequate numbers of personnel, and yet they do not employ more. Then that's an oxymoron. There's a problem with that health service delivery. As a result of that, we have had burnout, a lot of burnout, a lot of medical personnel who are working in general the health facilities are burnt out, and they have risk of occupational hazards of COVID-19. And these, as we said, can actually be pointed to the devolution of human resources for health, whereby you have the county governments currently, for instance. There are some counties that where the health workers have not been paid for 2 months, 3 months or so. So how do you expect a health worker who has not been paid for 2 to 3 months to manage COVID? First, he has been expelled from his house by the landlord. He has not paid rent. His family is crying out for food. You expect him to travel to the workplace, yet he does not have fuel. And then you want him to buy the masks and protect himself with masks. And then so our problems with COVID are actually not the COVID itself. It is the management of the health system itself, and particularly the human resources for health. We have come up with several recommendations, and especially of a human health service commission, just the way you see that the teachers have a teachers service commission. Now we are having differential treatment of similar cadres across counties. So one county at one time, they are being treated well, then the next time it is them not being treated well. And as you do not have the collective voice whereby you're your brother's keeper. You are saying the person in Homa Bay who is seeing the women, for instance, is the same as the one in Nakuru. But if the one in Homa Bay is not being paid, you, the one who is in Nakuru, cannot do anything about it as much as you may want to, because you are sort of devolved and you don't have a common collective. But we really ask the government to really rethink the human resources for health strategy for this country, and that way we will manage COVID. Now, coming back to the investment in health.
I want to hold you first before we get to investment in health, because the conversation still continues on Twitter. You can find us on Lookup TV, even on Facebook. Please throw in your comment and your questions as well. I want to rope in Eugene Anangwe, who is the General Manager at Lookup Media. He has worked in Rwanda for 12 years and has seen the kind of culture, because, Daktari, what we see down on the ground in the counties, we have communities and we have social gatherings still going on. We have people going to funerals, people coming from funerals, and not so much of sanitization being done, not so much of masking. People are donning masks as if they are ornaments rather than the protective gear that it should be treated as. So, Eugene, what kind of cultures did you appreciate with your experience in Rwanda that may be helping them combat COVID in this season?
Thank you, Ray. I think I'll try to hold myself back from asking Daktari questions. I'm always used to being on the side of asking questions and not being asked. But I want, first of all, to share in the line of where the problem is today. You would ask that question first, and then I'll slowly delve into the Rwanda situation. I think what's happening is that much as Daktari says that there's a burnout on the health workers, I think there's also general fatigue when it comes to the citizenry. I think you'll appreciate the fact that the attention given to the daily COVID-19 updates today is not the same as it was when the first case was being announced, the first few days when this was starting. So the general public seems to have said, hiyo ni ile ya kawaida tena. You know, there's a general feel of there is nothing new. When you tell us of the numbers of new infections and the numbers of the deaths, that is not solving the problem. I think the public is tired of that, and what they are looking for is, what are we doing to prepare for the next pandemic? What measures is the Ministry of Health, what measures is the government putting in place to tackle the next pandemic that we might face after COVID-19, or even if it was to come today during this COVID-19 pandemic. And I think going back to Rwanda, what I can tell you is that I may not be able to give you the exact comparative analysis as to the COVID-19 situation, because I left before COVID-19 came. But I'll tell you generally, the way of doing things in Rwanda has contributed immensely in how the country is managing COVID-19 today. Number one, I'll start off with the leadership. You know, the government through President Paul Kagame has been very vital in leading by example. You'll understand that even during the vaccination drive, the president and his wife, the first lady, came out publicly to rally the local citizens towards accepting these vaccinations. You'll also realize that there's a lot of accountability when it comes to the leadership. Every minister, every local government leader is accountable. So when there are rules that have been announced for managing COVID-19, it is not only the police's work, or it is not only the president's work or the Minister of Health's work to actually implement or enforce. There are local people at the village level who are tasked with helping to ensure that everyone is adhering to this particular pandemic. But over and above, I think the important thing was that the whole country was made to understand the importance of actually cooperating in battling COVID-19. When you're told about the risks of what you risk to lose if you drop the ball, if you lower your guard, then you understand why you must comply. But in our case, in many cases here in Kenya, we always talk about scenarios where people don't see the leaders leading by example. We don't see a situation where we are made to understand why should we do this, because we've lost, or majority of Kenyans have lost the trust in those who are telling us about compliance to COVID-19 prevention measures.
We know that Rwanda has lately taken a raft of measures, including ensuring that public servants are working from home. Movement has been restricted between 6 p.m. to 4 a.m. We have schools being closed and social gatherings being suspended. A lot of things, including, visiting gyms and the like. I'm just wondering how this can work within our space, because we've seen restaurant regulations, we've seen guidelines for schools, we've seen guidelines for just about every social or public space. But that element of adherence is what is causing a lot of problems because of our behavior. And other than that, you can't tell people to comply when there is no option for them in terms of maybe a measure. In other worlds, in Europe, in America, we've seen people getting incentives for their small businesses and the like, and maybe some little level of sustenance amount in terms of cash. But Kenya has been quiet. East African region, I haven't seen so much happening. And even worrying is a kind of lack of coordination within the region, with Tanzania just releasing their 100 cases in 1 year on Monday. That is President Suluhu Hassan announcing that. For a long time, we've not had anything. In fact, in the initial stages, Tanzania was even alleging or claiming that there was no COVID in that country. We want to take a short break at this time, but we are still reminding you to stay in conversation with us. This is a special edition of Diaspora Fusion, where we're looking at how East African states have handled COVID-19 pandemic. You can share your thoughts on Lookup TV, at Lookup TV on Twitter, and Lookup TV on Facebook. Thank you for your time. We'll be back with more. Welcome back to Diaspora Fusion here on Lookup TV. We are talking the region, East Africa, how we are treating COVID-19. The pandemic is surging in terms of numbers. We've seen a lot of deaths in the region. And we are looking at lessons that we can draw from each other. And that element of lack of coordination from within the region. We've seen Rwanda suspending, Uganda suspending parliamentary sessions because within parliament alone, they had 200 COVID-19 positive cases. What do you talk about? What do you see, or what's your take on the coordination within the East African community, or a lack of it?
Thank you very much again for that question. Actually, in the East African community, President Uhuru Kenyatta has done very well in the COVID-19 measures. He has given full authority to the Ministry of Health to coordinate this. If you remember, he formed a COVID task force at national level, of which I must report that Kenya Medical Association is represented by myself in that task force. But that task force is a one government approach, whereby all the partners put in their input towards assisting in management of this COVID-19. From that COVID task force, you had subcommittees, and of which there are several subcommittees, of which one I alluded to earlier was the Human Resources for Health Subcommittee on COVID, which made those recommendations of shifts and all. There has been other committees, of which like what is called Capacity Building Committee. And in the Capacity Building Committee initially was to train health workers on COVID, how to manage COVID, then capacity build all the way to the community. And part of it, that includes training, physical training on COVID. You've seen all those things of donning, doffing. Those are really technical. So together with the EGF Fund, Equity Group Foundation, Kenya Medical Association managed an 85 million grant, of which it was coordinating several sectors. The most important, another important component of it, that was a mental health aspect, where we are working with Kenya Psychiatric Association and the counselors to run a mental health program because of to manage all these burnout of health workers. There was even a core call center at the National Nurses Association campus, whereby health workers who are suffering COVID mental health issues were calling in.
Yeah, that is on the national scale, but I'm just wondering how coordination or a lack of it, because some few months ago, the World Health Organization boss, Tedros Ghebreyesus, was decrying the element of coordinating measures within and without country borders.
I think all countries, including Rwanda, have actually done their part. What we had a small problem with was the Tanzania issue. And we, as the association, actually also were in contact with Tanzania Medical Association. But you see, all decisions, COVID and management are political. So it's an assessment of your political understanding of the disease then that governs how the Ministry of Health will guide the COVID management. And therefore, personally, I think the Ministry of Health has done its part, and you see it from the plan, so to speak, of vaccinating people by June. Now, the vaccination plan, we as an association called it out as it was inadequate. You know, some of these decisions are made based on available resources. You see, but we were saying that for a disease like this, the more who are vaccinated in the shorter time, the better. Because as you have seen in Europe, we cannot be having double standard medicines, whereby in Europe you vaccinate everyone and then put them for Euro Cup finals. Then here, you've locked down people, but you have not provided the vaccine so that they are able to open up. The aim of lockdown, which I heard you mention about Rwanda, is to ensure you have done two things. You have strengthened the health systems by putting equipment and employing people, health personnel, and two, giving a way to ensure that they can open, which is vaccination. Therefore, as you lock down, you should be aiming at getting vaccines quickly, so you jab everyone so that when they come now, they can continue business. You have employed enough doctors, nurses, clinical officers, and you have provided hospitals with the ability that should that one person get COVID, you can manage them, oxygen, ventilators and all. Once you have that framework, you're good to go.
We are talking region, and we saw a few months, that is before President Magufuli, the late former president, died. We had a rough patch with our neighbors, Tanzania, but President Suluhu is come with quote unquote, as her name suggests, solution. Are we seeing any kind of, positive progress with President Suluhu coming? And especially that could be worrying or of concern is the amount of data that is coming out of Tanzania, Eugene.
Ray, I think, in my opinion, what we have seen in regional related issues, cross-cutting problems where we required to see regional coordination, we have often not seen that. And the challenge we've seen in most cases is nationalism. And nationalism affects in many ways because every country is saying everyone for themselves. And that's where the problem is. And you remember that they forget that if you deal with COVID-19 alone as your own country, and yet your neighbor has surging cases, you're still not safe. Because there's still that cross-border interaction and all that. So you'll still be able to face this particular problem. And that's what we're even seeing today at a global level. We've seen African leaders. President Kagame himself has decried what we are now hearing a new term of vaccine apartheid, where you are seeing, Western nations making it difficult for African countries to get access to these vaccines. And at the end of the day, we are forgetting that if one part of the world is not okay, it automatically means even you who thinks you are okay, you will not be okay. So in my opinion, the coordination aspect should have been seen at the East African community level, for example. We have organs, at regional level, but what have we had coming from the Secretariat when it comes to managing this do they then have the voice? Can they speak something and it is implemented in Kenya, implemented in Uganda, implemented in Rwanda? We have seen situations where we tend to feel that these organs, these institutions, do not have any impact on the region. The East African Legislative Assembly, what laws at their level have they come up with that would help strengthen the health sectors of the region? Harmonization of laws has been a problem in many cases. So every time someone asks about regional coordination, I feel like it's a wild goose chase.
Especially with globalization so much alive with movement of people. You know, when this pandemic began, before it was even declared as a pandemic, when the coronavirus outbreak started in Wuhan, people thought it was a Chinese problem. It only took a few weeks and months to be felt in just about every region of the world. And talking about vaccination, there's been a talk around having the third dose of AstraZeneca. I'm just wondering how sustainable this will be, especially for the region.
So back to the, before we go to the vaccination, I think President Museveni brought out the other day a very poignant point of no one will help you. You know, the way we talk,
you're in this
the
alone.
world is one, no, you're on your own, literally. And to help us, I think we need to look at each other as a block, and maybe we need to learn from the medics. The regulatory bodies of medical professionals recognize people trained in Uganda, Rwanda, Tanzania, you see, as one. So meaning that you do not, when you come to Tanzania as a doctor, then we only go to the board and say the board recognizes where you've been trained in Tanzania, and therefore you can practice, you see. That goes to now these health solutions that if one solution is found in Uganda, then it should be able to be used in the East African bloc. On the vaccine issue, I think President Uhuru Kenyatta hit the nail on the head the other day when he said, now the initial step is to get the product and pack it now in Kenya. And on a wider scale, we as the medics actually think that we should establish the manufacturing plants in Kenya. We have enough pharmacists, we have enough technical expertise to produce vaccines. The animal vaccines we produce in Kenya, we already have the capacity, you see? And that the East African region then can also leverage on production in Kenya, for instance, for supplying the whole region so that we become self-reliant. So we need to utilize our personnel, our expertise to make these vaccines. Now, in terms of the vaccines and third dose, first dose, that is another important principle that we need to adopt as a country. And I think when now the president started listening to the medics, then the policy is guided by science. You see, we tell you, by the way, that place, there are 20 COVID cases, by tomorrow it will be 30, therefore to prevent 30, this is what you do. But you are using data to guide your decisions, not politics, not hearsay, you see? And therefore, in terms of vaccines, so far we have had a lot of people in the medics who have received the 2 doses actually think it works because they have been in contact with a lot of COVID patients, and they themselves have sort of not yet. Some of the physicians I talk to, they say, hey, that vaccine, I think it's okay. Myself, I've been vaccinated twice also. So I feel relatively safe, so to speak. But they need to test blood and see, did antibodies form? You get what I mean? Because what's the role of a vaccine is to help form antibodies. So science will guide. So as the science, and COVID is relatively new, we cannot jump into conclusions too fast, you see? And therefore science will evolve and tell. So if in Europe they find that A, B, C, D has happened, then we say scientifically, we can apply it here.
Talk about science and data-driven interventions. What happens, because in 1 year, if a country like Tanzania has only recorded 100 cases, what has been happening from June last year when they recorded the first, when they started tracking these 100? How then do you manufacture, if that could happen, to enable you to get to the necessary measures that need to be taken, especially within the region, not just within Tanzania, but also across, because we have Tanzanians coming into Kenya and Kenyans going to Tanzania, Rwandese like that, and Burundi and Uganda like that.
Yeah.
What happens?
So data collection for a country, especially on health indicators, is centralized. For instance, as a gynecologist, I would say that if you have a mother dies as a result of pregnancy, that data is captured, and at the end of the month, the central database actually says, we know that 100 mothers may have lost their lives, 20 were in Kitui, 1 was wherever, then you go and examine what is the problem in that place. So there is a centralized way of capturing. So data capture should be enhanced. More important, we should fund research. We should get the medics to actually do research, more research, so that we develop what is called local data. You see, and for instance, we are saying the vaccines were made outside and they came here. Are they the same reaction to Kenyans as to the Europeans, for instance? So more research funding needs to be put there, but data needs to be collected. So you also need to know what data do you want to collect, and you create a tool to actually collect that. But there are data collecting for health. There are data collecting mechanisms.
I want to bring in Eugene if he has something to add before I come back to data on some special demographics that I would like us to talk about. Eugene.
Yeah, I think for me, I would say that Daktari's mentioned about the importance of science. I may not be a scientist, but I think what I would also look at is the aspect of common sense as well. Because I think in many cases we seem to be either accepting to be carried malenge kwa kizungu inaitwaje? Pumpkin.
Kubeba malenge.
Yes, you know, because in the end, much as we are being given this data, the question should be, what are we doing with this data? What is this data helping us to improve tomorrow? What is this data helping us to make sure that the situation is not the same the other day? Because these days it's a matter of, you know, quickly when the data is released, these are the number of cases we've reported today, these are the recoveries. We are not sure about tomorrow, how will it be like? The next other day, how will it be like? What did we do with this information to be able to help us to solve the problem? I think this is information that the Kenyans we talk to want to know, you know, how are we dealing with the situation of avoiding more spread, avoiding the deaths, strengthening our systems. Are we dealing with this problem just for today, or are we ensuring that sustainability is done, that even if another wave was to come, we would still smile and will not lock down people. We will still continue with our businesses because everybody has been vaccinated, because we have increased our facilities at the hospitals, we have hired more doctors. You see, when I listen to Daktari, I feel that we have the solutions. The solutions are there. But
Mostly
the question is, yes, you know, the very big ideas, very good issues that if we are to implement them now, I think we would not be worried about a 4th wave, 5th wave, because today Kenyans are worried. You know, we are not sure of, you know, can I plan for my wedding? Can I plan for the next event that I'll do as a person in the entertainment industry? Can I plan for expansion of my business? Because I do not know. So this data should be able to inform on what the government is already doing to ensure that tomorrow is much better. And so when I mentioned about common sense, is that when the politicians are out there to do these super spreader rallies and events.
Even in funerals, they appear not because there is need for them to even talk anyway, but they appear to use such gatherings to propel their political views. And maybe to bring in Daktari because of some short time that we have, there is a group of people, that is the breastfeeding mothers, who may be exposed, like myself and others, asking, when will we have data that Eugene is talking about and you are talking about, that is helping to have health officials reliably know that we can be vaccinated with a particular kind of vaccine. And then there is also the issue of malaria, especially within the western region, which is under, longer curfew hours at the moment, Kisumu, Siaya, Homa Bay, and the like. People are saying, I have malaria. I've had people reporting that I feel like I have malaria. People feel like if you have a flu, you have your joints a bit weak, then it should be malaria without diagnosis and etc. Then later on you realize somebody has died and it was COVID. How do we mitigate?
So as a gynecologist, the easier question is on the vaccine. So you can get vaccinated. And we say the vaccine that is nearest to you is the best vaccine. So the one that is available, you get vaccinated. So it's not a problem. So that some studies in obstetrics and gynecology have actually shown that some of the antibodies, so-called antibodies, are what fights the virus created as a result of the injection of the vaccine, are transmitted in breast milk and may protect the baby. So lactating mother can actually get vaccinated.
Great.
On the question of
confusing symptoms,
and again, the lockdown in quotes, it's really, Kenya has never had a lockdown. A lockdown is where you actually don't move 24 hours, you see. Some countries like Spain, Italy have actually had lockdowns. So Kenya, we are still playing between the economic, and the aim of that is just to restrict some activities that may be increase spreading. Of course, our nightclubs and all. So it's much easier probably to spread and that. So those movements, restrictions, are meant to reduce the
contact.
Now, and that's the importance of a health system. So the person next should, in a dispensary, should be able to have a COVID test and a malaria test to know that the fever is COVID, malaria, or both.
And it comes back to resources.
It comes back to willingness to improve the health system and therefore allocate resources to that particular health center and employment of staff to that. So there is no rocket science. To distinguish between malaria and COVID, you do the test. And therefore, these tests should be available at the lowest dispensary in Homa Bay, inside there, you see. So as Kenyans should actually ask for the highest quality of healthcare by ensuring that we have resources allocated to health. And
we have to be willing to take the COVID test, for instance, if you go for malaria test. Eugene, your final thoughts?
I think I'd speak of what I wish to see or what I wish to hear. I know I've mentioned some of them, but much as we talk about willingness and availability of these tests, we must also consider cost. If we do not make these tests affordable, if we do not make these tests easily, someone to be able to do it or to take it, we are already facing tough economic times. And here you are telling me that I go to the hospital, I already know the malaria symptoms. I think it's malaria, but it could be COVID. Now that I don't even have my job, my shop is closed.
Not afford another test.
I'd rather just self-treat myself, thinking it's malaria. That's the problem, and we need to fix that as a government. I mean, I'm not part of government, but this is what my wish is.
Indeed.
The government also needs to create a lot of trust. When the citizenry does not trust or has an issue with trust, then most of the initiatives you'll come up with, they will not really believe in them. When we hear that announcements that some of the COVID jabs that you took could be water, you might have been vaccinated with water. You hear of some fake vaccines have been in town. Even if you're taking the jab, you start being scared. You don't know whether I did. And if you haven't been vaccinated, you'll say, hey, better me who did not even take any of that. So the level of trust is very important.
That's great.
If we do trust the government, we will always fall into what the initiatives they come up with. And that's what I saw in Rwanda. There's a lot of trust of the government. They believe in the government. So when the government says it is this direction we're going, you'll see a majority. Yes, there could be some who will say, no, we won't take that, but a majority will move to other direction. And that has saved Rwanda in many situations, during many crises. And I think that's what we need, and even better.
Thank you so much, gentlemen, for joining us on this special edition of Diaspora Fusion. We've been talking COVID-19 in East African region. Governments have a role, and you too have a role as a person. You can do masking, you can mask up, social distance, avoid social gatherings, wash your hands, and do everything that you can to ensure that you're safe and you're keeping others safe. This conversation ends on TV at the moment, but it continues online on our social media pages at Lookup TV on Twitter and on Facebook as well, Lookup TV. Thank you very much for joining us. Until next time, I'm Ray Polo.